I'd like to introduce to you Samuel Matsikure, who's steering committee member of the Global Forum on MSM and HIV from Zimbabwe, and Krista Lauer, policy associate for the Global Forum.
Good afternoon, ladies and gentlemen. It is such a privilege to be standing here today among courageous and most dedicated people that I know in fighting HIV and also fighting for sexual rights. It is also encouraging to hear such message from people that acknowledge our work. We heard this morning from Michelle Sidem that the work that we are doing is bearing fruits. The laws are changing in certain countries, but we still have to forge on. In the last couple of weeks, it has been a tough time for Zimbabwe, especially the gay and lesbian community. Our offices were raided, we had to close down. The community was running scared. Part of that is that the organization is being charged for possession of pornographic materials. And these materials are the materials that we are trying to provide for MSM prevention. So we still have a lot of work to do, but with your support and the messages that keep coming, we are all encouraged. This is not only the acknowledgement for girls only, but it's for all of you who are here from Africa, Asia, Latin America, and the rest of the regions. There are other great people that are doing this work behind that probably are not here, but we also hear other people who are doing this great work that are here. And I'm humbled today to be standing in front of you and saying thank you for giving us this opportunity. And it's from you, the energy that we have each day comes from most of you. Thank you.
Thank you, Sam. In my role, I have the humbling privilege of getting to work with inspiring and extraordinary advocates and implementers like Sam and so many others like him. Thank you all very much for being here today, and as Sam said, for those who could not be here. I also have the privilege today of introducing the moderator of our next session, who is renowned as a passionate and unrelenting advocate, bringing action to bear on addressing the intersection between social injustice and HIV risk. Over the course of his career, he's led the Ontario New Democratic Party and spent nearly 2 decades with the United Nations, serving as Canadian Ambassador to the UN, Deputy Executive Director of UNICEF, and from 2001 to 2006 as the first ever UN Special Envoy for HIV AIDS in Africa. He currently serves as co-director of AIDS-Free World, as Professor of Global Health at McMaster University, and as Chair of the Board of the Stephen Lewis Foundation. But to be honest, I'm sure that he doesn't need any introduction because you already know him. If you have ever heard him speak, I'm sure you have not forgotten because his words stay with you. He inspires and challenges us all to bring an end to this epidemic and to never lose sight of the urgency of this race against time. He's gone about this work at all levels, ranging from the highest offices of power, recently speaking out at the Commonwealth Heads of Government meeting against proposed anti-homosexuality legislation, to proposing grassroots action for those in need of support. And here I'd actually like to highlight his Grandmothers to Grandmothers initiative, which to date has raised over $9 million in support of grandmothers in countries in sub-Saharan Africa. And the reason I do that, which is also indicative of his reach, is that my own grandmother told me to tell him when I saw him that she's a supporter of the program. So, for fighting for equality and the HIV response and ensuring that no one is left behind, it's an honor to present a hero of mine, Mr. Stephen Lewis.
That was an entirely amiable and delicious and faintly hyperbolic an introduction, and I deeply appreciate it. I hate holding a microphone in one hand because I require both hands to gesticulate fulsomely in the course of my observations, so I refuse to be constrained by technology, and I'm assuming that I can speak with sufficient rhetorical strength to be heard even unto the farthest corners of the room. I feel immensely privileged to be part of this notable gathering today and to share a platform very shortly with the panelists who will be assembled for the final series of observations, which I shall pretend to moderate simply by introducing them. I sat through this morning's session with, as many of you, an intense fascination, and recognized that many of the themes which I need not reconnoiter yet again were dealt with, whether it was levels of infection or lack of access or human rights or societal homophobia. I'm not going to drive those nails through the wall because they are well and truly understood by everyone in this audience. And I don't want for a moment to depreciate the inestimable difficulties of life which are faced by so many in the MSM movement. But I wanted to tell you, for what it's worth, that for me this morning, there was a significant moment of revelation, which I found frankly thrilling, and it suffuses the molecular components of my body, and I want to convey it to you. I thought that the Chris Byrer presentation was a breakthrough, both in the content of the data and the analysis which accompanied it. And I want to try, if it isn't presumptuous, to convey from the point of view of someone working with colleagues in our little group AIDS-Free World, some of whom are here, I want to try to convey to you what it said to me. I don't want to overstate it, but I do want to try to divine the significance. I want to remind you, working, I think, correctly from memory, that there were 133 studies assessed, that there were 130 individual unique records taken, reports, that we then found, Chris found, reliable, unassailable data from 50 countries. There has never been such an assemblage of data in this field of MSM and HIV before. And overall, as everyone looked at the PowerPoint presentation, it was evident that in all instances, with only one or two rare exceptions, in all countries surveyed, the prevalence rates amongst MSM were astonishingly higher than the prevalence rates in the general population, and that was inevitably intensified and accelerated in conjunction with injecting drug use. But when one looked at the modeling, where there was universal access for men who have sex with men seeking treatment, that is to say, full coverage, and further enhanced by 60% coverage where IDU was a factor, then in every country that was most closely covered, the prevalence rates came down. And the countries, you will recall, were chosen regionally. You had Kenya, you had Thailand, you had Peru, you had Ukraine. And the implications, the extrapolating implications were that those four countries, showing explicitly the decline in prevalence, could be applied to the larger region of which they're a part. But the point which is so extraordinary and for me so exciting was, of course, it wasn't just a decline in prevalence amongst men who have sex with men. It was a decline in prevalence in the general population. We've never been able to make that argument before based on such unimpeachable evidentiary base. It's quite extraordinary. so that now one has the reason and the legitimacy to make the argument by incorporating MSN into the broad integrated treatment network, we are serving the objectives of the entire population, and it then becomes 1,000 times harder for the Philistines to argue in as much homophobic rhetoric as they can summon that those who are in the realm of MSM must somehow be isolated, marginalized in the response. For the first time, we can make that argument about complete coverage, and frankly, it's a breakthrough by way of the epidemiological finding, because of the way in which the world has tried so hard to isolate MSM from the broad treatment prevention care apparatus. And then you throw up a series of slides on the wall to show that the entire general population of a country benefits. Precisely the interaction of all of that will probably be explained more fully at the plenary session next Thursday, but it is, frankly, an exhilarating advocacy weapon. I can't wait to get hold of some of these countries and to pummel some of these obdurate and idiotic